My name is Kaulukukui, and I am a former state director, migrant state director. I've been involved in the migrant program since 2005, and now I'm an independent consultant, and I'll be facilitating today's meeting. Alex, we can start the recording. The title of our session is How COVID-19 has impacted ID&R and how we provided services to the MEP families. This presentation is going to be a panel discussion by two state MEP directors who will address issues faced by recruiters, which can alter the scope and type of services a migrant family and their children need to access. This could include a combination of social, emotional issues, health issues, issues related to falling behind academically due to the impact of the digital divide. Our guest panelists have a lot of experience that they are willing to share with you. Both are state directors, as I mentioned. Unfortunately, we are still waiting for one of our guest panelists. She is on an important phone call, and so she will be joining us when she can. But we have our other guest panelists, and I'm welcoming Sue Henry. And Sue is the state migrant director for the past 27 years. She has had the privilege to support migrant children and families through Title I-C migrant education program. She began her MEP career as a local project recruiter, and over time advanced to the statewide ID&R coordinator and regional project coordinator positions. For the past 17 years, Sue has been the Title I Part C Migrant Education Program Coordinator at the Nebraska Department of Education. She serves as the lead state representative for the ID&R Consortium, or IDRC.
IDRC.
And she also serves as the Nebraska Department of Ed representative for the ISOSY Consortium. And she's a member of the Interstate Migrant Education Council, known as IMEC. Our other guest panelist and we're waiting for her, is Carmen Medina. Carmen is the state director for the state of Pennsylvania. Carmen is the chief of the Division of Student Services in the Bureau of School Support at the Pennsylvania Department of Education. She oversees 5 initiatives, including migrant education, refugees, school impact grant, teen pregnancy and parenting program, 21st Century Community Learning Center, foster care provisions under ESSA, and the homeless education, or also known as McKinney-Vento. In addition to overseeing these programs, Carmen is a member of the Pennsylvania Department of Education Data Governance Council and Credit Recovery Flexibility Work Group. She's an incoming chair for the Interstate Migrant Education Council. Carmen is a former chair of the Governor's Advisory Commission on Latino Affairs and former president of the National Latino Peace Officer Association in Pennsylvania Gettysburg chapter. In 2004, Carmen received the honor to be the recipient of the Pennsylvania Latina of the Year Award of the National Latino Peace Officers Association, and she was presented with the key of Gettysburg Borough. In August of 2005, she was selected as one of 12 Central Pennsylvania Women of Strength. And lastly, in 2018, she was selected at the top 100 Pennsylvania's most influential Latinos. Carmen is an alumnus of the Leadership Development Institute for Women in Government and a fellow of the Education Policy Leadership Institute. She's a very busy lady.
Yes, she is.
And so she'll be joining us shortly. The format for today's presentation, we go to 11:15 Central District Time, Central Time Zone time, I'm sorry. And the format is more of each panel. We have a set questions that we have put together to ask each panelist to respond to. Basically, the questions center around, sharing with our audience a little bit about their program, and then getting into the challenges they faced in ID&R and MEP when the pandemic came into effect, and currently what is happening in their state, as they move forward, as everybody moves forward in this. There she is. Carmen, good morning, Carmen, and we just
Good
got
morning.
introduced
I
to you.
apologize.
Not a problem. Not a problem. I'm just going through what our questions are. So, so besides, the challenges that the pandemic came into effect, they'll also hopefully address impact of the pandemic on their families. And then if time permits, we will try to go talk about fiscal and challenges that they have faced as state directors when we talk about fiscal accountability. We have, believe it or not, we have over 245 people. Thank you. Thank you for participating in this. When you always do a presentation at a conference, you always hope that at least one person comes. But now we have 245. So for the sake of time, if you have a question, please put it in the chat box. And if as best as we can, we'll try to address them, but knowing that there's 240, now we're up to 250, 253. Whoa. I'm going to put in the chat box Carmen and Sue's email address. If for whatever reason, and I apologize up front, that we are not able to answer your question or get to it, you can email them directly and hopefully they'll be able to respond to you on this. But knowing that we have 254 people participating, that's a very big number for us, but we'll do our best. I'll be facilitating this meeting, and I'll be checking the chat box, and let's get started right away so we can have time for, as I said, these ladies have so much wealth of knowledge to share, and this meeting is also being recorded, by the way. So thank you, Alex, and the IDRC committee for putting this all together. Now, in our introductions, I'll be remiss if I didn't mention this. In our introductions, there were several times for Sue and Carmen, I mentioned the participation in the IMEC or in council. And the IMEC council is the full name is the Interstate Migrant Education Council, or IMEC. And just in case those of you who don't know about it, this organization was established in 1983 as a 501c not-for-profit organization. IMEC's mission is to advocate for the highest quality education and other needed support for the nation's migratory children and youth. Currently, IMEC's membership is made up of 26 states, of which Pennsylvania and Nebraska are two of our states, and Carmen is our chair of the IMEC Council. The executive director is Mr. Francisco Garcia, and as I mentioned, our two presenters are both part of IMEC. You want more about this organization, I will put their website on the chat box as well. So let's get started. Our first question for our panel is, and we'll start off with Carmen. Can you please share a little bit about your migrant program in your state?
Good morning, everybody. In Pennsylvania, any given year, we can serve over 5,000 migrant students. We serve obviously 3 to 5, but Pennsylvania receives also state funding in our state budget, and that gives us the opportunity to serve the 0 to 3. So in Pennsylvania, we actually serve 0 to 21 years old migrant students. We are a rural state. We only have 2 big cities, Philadelphia and Pittsburgh, and the rest is rural. And we are a year-round migrant program. We receive migrant families throughout the year because we have processing plants. We have mushrooms. We're considered the capital of the world, the mushroom capital of the world. We have a lot of dairy farms. And also we have the seasonal, that is apple, the orchards that is in our south central Pennsylvania. We have evergreens. We have big farms of evergreens, and we have a national company for tomatoes as well. Is in a nutshell. We divide the state in regions. We do not fund school districts. We have regional offices, and they are the ones that receive our funding to identify, service the students, conduct the parent component, and work. Every region has their own data specialist. We have recruiters, recruiter coordinators, data specialists, and what we call student support specialists as well. They work directly as a supplemental service with the families. They connect with the schools, and we provide all supplemental services from in-home services to campus services. And during the pandemic, obviously, everything was changed into virtual, and we will talk more about that at a later time. I can say a lot more about it, but I know that we want to get to the other questions, and so I will stop there. And that's in general an overview. Thank you,
Carmen. Thank you, Carmen. So now let's hear from Sue and what's going on the Nebraska migrant program there.
Great. Nebraska, much like Pennsylvania, our count is around the 5,000 mark. It's dropped a little bit. It's to more exact numbers is more around 4,500. Currently, of course, last year with COVID and the year prior to that, we had a lot of flooding. So the migrants that typically come in the spring and summer didn't come in the numbers that they typically do because of, again, the pandemic and the flood. The migrant education program is organized in 5 regions, and within those regions are 15 either LEA or regional projects. We also have a state ID&R coordinator, PAC coordinator, data and service provider, state coordinator. So I will give a shout out to Cesar. I think this is his day 3, maybe day 4 on the job, but what a great group for him to be with today. Our top qualifying activities in the state is agricultural crops, corn, sugar beets, hay, beans. Also, we have a lot of feedlots, dairy, cattle and hogs, and I mentioned dairy, and then also some processing plants, have several processing plants, both beef, pork, and chicken. Some of the agencies that we coordinate with a lot is with Migrant Seasonal Head Start, also the Department of Labor. Proteus is also funded through the Department of Labor. They're in 3 states, Kansas, Nebraska, and Indiana. And currently we are doing some coordinating in regards to the referral system through Proteus and the migrant program. So I'm excited about that. Also, another partner is University of Nebraska Medical Center, their public health, and that coordination really increased due to COVID, and some good activities have come through that and will continue, and also legal aid. So the majority of those agencies that I mentioned, they have representatives. We meet on a monthly 6-week basis and really just keep in good communication in regards to the migratory patterns of the workers and children and families that we serve. Nebraska is the lead state for the IDRC consortium. And I just have to say, this year they have just really increased the activities, and it's in great need across the nation. So it's been good that we've been able to meet the needs, especially in the identification and recruitment activity. And last but not least, I would like to, if I didn't, I want to be sure and welcome everyone that's joined us today.
Thank you, Sue. And for those who have just joined us at the start, we really don't have a PowerPoint presentation or handouts. This is more like a panel discussion on these two ladies, Sue Henry from Nebraska and Carmen Medina from Pennsylvania, and their knowledge and what they shared with how they had to work through issues that they faced in the last year or so with their program and still be able to bring out a high quality type of program that they have. Our next question that we have for our group is to address, and maybe we'll start off with Sue on this, is what challenges did you face with ID&R and your MEP program once the pandemic came into effect? And what is currently happening in your state? What were some of your successes?
Well, the only way that I can express what happened in the beginning of the pandemic was disarray, and the world stopped. Not only was pandemic, or due to the pandemic, the state office building, actually, I should say the Nebraska Department of Education, closed the office. And so we were transitioning from a office building to home, and not having all the resources in an office I didn't have in my home. So just very surreal because of the pandemic. I know Carmen and I have shared it, almost freezes you in not knowing what to do, not having the resources, and actually having some guilt feelings from that, because you know you should be helping this team of people through this pandemic as well. And you as an individual didn't feel adequate to do that, or couldn't access the information that you really felt that they needed. So for Nebraska, there was a pause. Luckily, we had many states, the migrant education program, there's so much interstate coordination. And after a few weeks, that took up right away, if it was even that long. So multiple states got together and just really talked through the challenges of each state, many of them similar. But in regards to identification and recruitment, we had to work through how we would complete the COE. The majority of us are on an electronic COE system, and we have to, it's required, we have the signature. So we had to, we involved the Office of Migrant Education to see if they would approve, in which they did, is electronic signature of the parent or the person that completed the interview. So some of those things take time. As we were hearing from the field, food was of the essence. It was a high need. Now the migrant program, we do support nutrition services more on a limited basis, certainly not at the volume that the pandemic was demanding. So again, we submitted as this networking group determined that we felt we needed approval from the Office of Migrant Education. So, but to hear back, there was a system put in place through USDE that you had to send all questions. So there was a process, and it did take a couple weeks to hear back. So that is really, that was the spark to get going and start setting that plan. And Saul, I know I'd mentioned to you, and I truly wish I could remember who it was, but early on, I thought there were a lot of Zooms, more Zooms today than then, but plenty back then. But this presenter talked about the 10-80-10 rule. And anytime there's any kind of an emergency, or like the pandemic, 10% right away say, let's start planning, and and they start laying it out. 80% will, they just, I'm gonna hang back a little bit, see what the leaders do, and see if they give me something to follow. And I really felt that was where I was. just hanging back, waiting for somebody to take that first move. And the other 10%, sadly, they're just paralyzed, and it's just whatever is affecting them is just overwhelming. So I said, I'm in that 80% group, but I need to get that first 10%. I need to get things in order. And so that's when it started. And certainly didn't do it on my own. There was a lot of that interstate coordination that happened before the pandemic, during the pandemic, and I know will continue. And also the other part is the Nebraska Migrant team. Couldn't do it without them. Because when I had to sit and try and get things in order, some of them were already in that 10%, and they moved right away. And they, were communicating with the families and meeting their needs. So that is those were some of the needs necessarily. But the things and the solutions that I'm grateful for is, again, our Nebraska migrant education program and the plan that was in place prior to the pandemic. I did keep reflecting and saying, man, if we didn't have, a good ID&R plan, or if we didn't have a good service delivery plan in place, we would have been a lot worse off. But we did have things in place, which did help us in a different format, in a different way, but to move on. That's when we began networking with UNMC, the University of Nebraska Medical Center, and other community agencies. Again, we had done it on a different level, but the pandemic just really set things in place. UNMC, they did some tours of plants and provided the processing plants some suggestions in regards to ways that they could, or practices that they could use within the plant to decrease COVID, because if you watch the news at all or you work with the plants, COVID was rampant in those plants. Lots of recruiting, as I mentioned before, via telephone, possibly Zoom, but not much going on last summer on site. One of the other things is that virtually our state PAC coordinator went to Zoom and over the year, and parents were attending it in higher numbers. And a result of that is a few weeks ago, we had a virtual parent and student conference with over 200 attendees. So it was awesome. It was a great event.
Thank you, Sue. I think the presenter that you were talking about on the 10-80-10 was a guest presenter who shared with the Interstate Migrant Education Council in one of their Zoom meetings. And
yes,
he gave a lot of great advice to the folks. Just a follow-up, Sue, what was the social emotional health of your staff during the pandemic time, during this? Was it the issue that you folks had to address?
For the staff?
Yeah.
I think that was really dealt with more at the local level. I know that the coordinators of the different projects, I know there was through ISOC, there were some social and emotional professional development opportunities, and I'm sure there were at the local level as well. But tried to keep tabs and have some monthly meetings, and the directors would report out about the staff or exactly how they were continuing to operate. It was hard for them because as recruiters, yes, but all staff that are working with families, they had very concerned because of such a high need of the families that they're serving. So no doubt there was some sense of inadequacy not to be able to perform at the level that they were used to help the family needs.
Yeah, and I think you mentioned another issue that was, I think, prevalent across the nation is families wanting to know where they're going to get their food. That was a big issue for what
Yes,
families were looking for in that.
yes, very much so.
Thank you, Sue. And again, for those people out in the audience, if you have any questions for our panelists, please put it in the chat box and we'll try to answer it as soon as we can, as best as we can. Okay, I've been asked to turn up my volume. Okay, so hopefully this is a little bit better on there. Sue and Carmen, can you hear me?
Yes.
Okay. Let's same question about during the pandemic. Why don't we hear from Carmen and what happened in Pennsylvania?
A lot similar of what Sue said. Everybody went into a state of shock. I always describe it like somebody slapped us on the face and we were like, what just happened? And dealing, I felt that I personally turned to be from supervisor to wife to mother to big sister to best friend, counselor, to the staff, because everybody was affected. Also, when you have great staff, like we have in Pennsylvania, I'm extremely proud of them. You are thinking, how are they being affected? And you wanted to provide, their support. And when they are seasoned, that they are so used to go to those employers that they know, that they can walk into the the human resources office, and they said, here are all of our referrals for you. And now they can't do that. They feel like, how am I going to do this job? And when the numbers started getting going down, or getting right there, not moving, they were worried, am I going to lose my job because we don't have numbers? And providing all that support, we did a lot of self-care training. Jose Reyes is our statewide recruiter coordinator, and he was checking with the recruiters on the field, what are the needs. We through Jose, we got a lot of PPEs that we delivered, figure out, but it wasn't just to secure the PPEs, is then you have to plan. Everything had a next step and a next step. Plan, how are we gonna get these PPEs to the regions? Because everything is non-contact. When it came to the families, one of the things that we immediately did was we survey our field staff, not only about their needs, but also what were the needs of the students, needs of the families. And we started, each region started developing their own plan and checking with the state office, can we do this? Can we purchase this? And this is a problem that we have. Doesn't matter how many hotspots we get where these families live, there is not even a cell tower. How can we help them? How can we get our referrals? The schools were closed. The employers didn't want anybody on board. So we started thinking and planning of what was the next step, because we weren't sure of what could we do, but we all came together. Like Sue said, the group of states, we stayed very close, and we're still very close throughout the pandemic, because we're still under the pandemic. And we communicate and we compare notes to see how we could replicate practices from other states, what could be used or not used. And I encourage the audience to, if you haven't reached out to other states, do that. It's not a competition. We are in a very critical times, very special times, and borrow ideas from everybody. We have a lot of, like I said earlier, Pennsylvania is very rural and it's a large state. So we have families that are in small pockets in very rural areas, and there is the limited exposure of having a recruiter there. So how are we gonna find if their family came this year, if there is somebody there, how we're gonna do these services. A lot of our farmers did not want anybody on site because they were trying to avoid any type of contamination. The same thing with the processing plants. So that inability to visit the employers, the community-based organizations, school district was a big hurdle. But because all of our recruiters had such a strong relationship with these entities prior to COVID, they were able to start communicating with them. But when you start thinking everybody is in a mentality of chaos, so some things I don't have to bother with the migrant program because I have to run my business, I have to run my school. So even though that relationship was there, was still very difficult, that communication. In working with the recruiters, that they felt that they couldn't do their job because I can't talk to the family. The communication with the Office of Migrant Education was crucial when we presented. Pennsylvania was one of the many states that sent the question if we could do the virtual COE, and they sent us the response, yes, you can do it via phone, via Zoom, whatever virtual matter. And then the question came, so what do we do with the FERPA piece? Because FERPA, you actually needs the signature of the family. So like I said, you thought that you solved one problem, but it came another one that you have to solve. And it gets to a point that it gets exhausted, but you cannot give up because of the families. We partner with agencies like the Head Start in our southeast area. The Head Start offer to partner with the migrant program, deliver lunches to the kids, to the homes. Because the schools were offering lunch and the families could go to the school and the kids to pick up their brown bag lunch. But a lot of our families don't live in a walking distance from the school building. So, and the parents were working. So how these lunches were gonna get to the kids? So Head Start partnered with us to do non-contact delivery, and we were able to get those. We're still delivering lunches to the kids. Um, and that survey was really crucial because we were able to see exactly where the issues were. And we created in Pennsylvania a guidebook that is helping us throughout the pandemic. Every time we get a new decision from the Office of Migrant Education, we update the guidebook. And if anybody's interested, you can send me an email. If you know Jose, please, you can contact Jose as well. We will send you an electronic copy where we explain our staff, this is how you're gonna operate under the pandemic. So it was very difficult. Also, Pennsylvania, the political climate in Pennsylvania always has been pre and during the pandemic, hasn't been the most welcome for migrant workers, even though they want the migrant workers. So we have to navigate those pieces as well and get very creative. For services for the kids, we created a Padlet, and we can send that link as well, where every piece of information that we got from 0 to 21 years old is included there. There is a tab for recruitment, and it's a living application that we keep updating information and having it there. And I asked recently a couple of my field staff, if you had to name one challenge, the biggest challenge you had during the pandemic, and they said when it comes on serving students was the student motivation. Students were during the day taking classes virtually, and here comes Migrant after that, and I don't want to be on a computer all over again. And also the families. When we turned to be and call us paranoid or whatever, but we were, every time we saw something that could be a red flag, a sign, we will take that red flag and we will interpret it of how we could improve. We did a PAC meeting virtually, and we have over 100 parents from one region. So the message we got from there is parents want to talk to each other. They don't want to feel isolated. So we had been increasing those PAC meetings. We're doing a virtual, starting this Friday, a virtual workshop series for the parents. We created for the summer a 1-week virtual program, interstate, that we invited other states. So it's all about being creative and checking what the mandates of the program, because that was the big key. You must follow the mandates of the program and how that can be interpreted in order for you to be able to do your job.
Sorry, Carmen, I was responding to a question. The for those in the audience, Carmen and Sue's email address, I put it back in again. And thank you to Jose for, he also put the packet that Carmen mentioned. He put a link in the chat box, and that for those of you to access the questions. I think what both of you have shared has been really important to know, and this kind of sets Migrant ahead of other federal programs that I've worked with, is that this interstate coordination, to be able to pick up the phone or go on the computer, or even when you have a chance to, when you do have a face-to-face meeting, to be able to coordinate with other states to learn from what they've done, or learn how they did things, really in a sense like this pandemic, really helps to get through, as Sue was talking about, that 10-80-10, to get from that one group and move forward on there. I mean, this is a unique group. It's almost like what we say, it's almost like a family. And to be able to pick up that phone and know that your family members have your back and you have their back too as well. And nobody told us how to do it, but somebody figured out something that can help us for that. So I appreciate what you both have shared. And again, if people have any questions or comments, okay, so I think is that that people who are not on Zoom but are on Mova, they are having a hard time getting the information. So again, we'll try to get that out to you folks, and we'll continue moving forward on there. So thank you, and Alex, thank you for reposting that. Okay, people are not being able to, no posts in the chat with the email, no history chats either. Okay, we'll try to figure out a way to get this information to you folks on there. Okay, so thank you, Sue and Carmen. Let's move on to another question. You talked about working with families, and and some of the struggles of what they, a lot of them was, Carmen talked about how to get PPEs to them, and Sue talked about food being an issue. So what was the impact of the pandemic on your families? What support were they requesting from the migrant program? I'll pose that question to Carmen first.
Okay, thank you. So food is in the top of the list. Also, understanding what was going on in the schools for their children. That was a big on the top of the list for our families. Challenges for them from learning the technology to the language barrier to now I have to be the teacher at home, but I don't have the knowledge, the background to understand, to explain the lessons to my child, regardless if they were in English or their own language. And that's where the migrant program starts stepping in and helping that connectivity. We have migrant families that live in Philadelphia, and because there are so many buildings, the signal doesn't get there, their internet signal. And the kids attend Philadelphia School District. Philadelphia School District at the beginning of the pandemic, they were trying to be creative under the state of shock, and they were saying, well, the McDonald's is still operating through the drive-through. McDonald's have an open Wi-Fi, have the kids go to the parking lot of McDonald's. And I was appalled by that. What, the kid is gonna sit there for 6 hours to take classes. So we started having conversations with the Office of Human Services in Philadelphia, and they are in partnership with the city of Philadelphia, and they open centers where the students now can go there, and those centers have their own Wi-Fi's. But we had also our rural areas where not even a cell tower is there. So they couldn't we could purchase hotspots and deliver to the homes, but there was no use for that, and trying to be very creative. And when it came to recruitment, it was, how do I get my referrals? Where am I getting it from? Who to contact? But our recruiters are very creative, and under the leadership of Jose, they start seeing of what are you doing in your area? Oh, let me try this, and start coming up with ideas of how to do all that outreach, and checking. Some recruiters in some regions, their regional director was able to negotiate with their human resources office and change their job description, where they put put them on the top of the list of those providers that were allowed to go out on the field, and change the language in their job description. And in that way, they could be out on the field, but they were afraid for obvious reason. That's why we got them a lot of PPEs so they could use it, and giving all kind of trainings, following CDC guidelines and so forth. So one of the things has been, by having that constant communication, and I was going to mention it earlier, a key on all this is communication. Not only as the state directors that we have gone together to share information, to discuss from frustrations to successes. It came the part of that within the state, everybody needed to communicate. and they have been able to adapt and start using more online resources to the data to get those referrals. The recruiters have gone more tech savvy. My office gave the charge to their regional directors that they needed to assess not only the recruiters, but all staff technology skills were at the level so they can give them fill those gaps that they had. They realized that they were saving time with travel, even though they love to go out on the field and talk to the people. A lot of professional development from national to the local. Thanks to the to the consortium IDRC that they had provided a lot of support, a lot of trainings. Their recruiters themselves, mainly recruiter coordinators, they got together and they called themselves the think tank, and they were meeting. They started on a weekly basis because there was a need to all the way to now is as needed, but they start meeting virtually and discussing the different issues that they were facing and sharing ideas. So one lessons learned of this is that, like we call the program, the migrant family, is like a family. You need to talk to each other. Some people won't like the others and so forth. But we are a big family. It's not a Pennsylvania family. It's a national family. And we need to talk to each other and to share so we can help. We are in different times, and also if there is any statewide recruiter coordinator in the audience, my advice is you need to work with your recruiters and a lot of support, because when it's a human, by human nature, when you're used to do things one way, it's really hard to make a change. And also the bottom line is that, are we gonna go back as how was before? We might to an extent, but it's not gonna be the same 100%. Some of you might know already that you never will go back to an office. So that's one big change. Others, I might have to go twice a week or all the time, but not everybody. So do we have, anybody has an answer when this pandemic will go away? No. So it's something that by nurturing each other, by supporting each other, we can get through this, and we can help each other, and we can help the families. I always have said in my state, the recruiters are the heart of the program. Doesn't matter how much money I have for the program, but if my recruiters are not out, are not finding the families, they are the first face families see. And we cannot deliver any support or services. So helping recruiters is crucial in these difficult times, because they have the most difficult job right now from the migrant program. Thank you.
Thank you, Carmen. I think the one thing that you stressed at the end is, when I was a state director, I always said that ID&R was the lifeline of the program. And if you don't have ID&R, you don't have a good team in the ID&R, your program is nothing. And I think the other thing that you shared too, I think is the trust that the families have with the recruiters and with the program. That during this pandemic, we had to pretty much regain people's trust, or we became the information source for them. So what was the impact of the pandemic on your families in Nebraska?
Well, we've said it time and time again, and I think that just, we're telling how much of a need it was, food, for weeks, and still was food. And so our staff, didn't really matter what your position was, because as Carmen said, we're a family, and if there's a need for the families we serve, everybody jumps in. So in some school districts, the food would have been taken to the family's homes or a drop-off site for the families to pick up. But some of our migrant families, the staff did take it directly to the home because they were too far from the drop-off site, or the busing or transportation didn't take it directly to the home. So it truly took a statewide team to meet this need. One of the other things that some of the project directors or coordinators expressed were mental health issues. You mentioned that earlier. Mental health issues with some of the students, and whatever it took to help that student. I know that a couple of them, they loved to draw. They were great artists. So we made sure at a minimum that we could provide those resources for them, to meet part of the need of their mental status. The other part is we had a young man, very giving. Not only do I work for the program, but I know over the years my whole family has worked for the program, and no different than this migrant staff member's son, who was a counselor. And we had a few folks in dire need of some counseling. And so as a certified counselor, free of charge, he provided the counseling for those individuals to get them in a place where they had better coping skills. So there were so many people, even in the community, that came to the aid for the migrant families. Another impact we touched on was in the processing plants. They are considered essential workers. So we knew that some of our migrant workers were still working in the plant, knowing they had symptoms of COVID, or fear of, if they didn't show up for work, that they would lose their job. There was a lot of pressure on those families, and especially the workers. So again, I was glad that with our network with University of Nebraska Medical Center, is that they had developed the just basic flyers in regards to the washing hands, social distancing, educating the parents. So that was considerable amount of time, but well spent, as I mentioned earlier, with a particular group that addressed those types of things for the families. With the recruiters or all other staff too, just well educated on some of those common practices and providing resources or even information to our families. That's all I can think of right now in regards to how the pandemic did affect the families.
I think go ahead, Sue.
One other thing I thought of was concerns, because some of the workers, they travel a significant amount of mileage to get to their jobs. And so there's 8 or 10 people in a car during COVID. And that came up in conversation too, and just educating them to wear masks. They weren't going to change their practice because they had to go to work. But at least at a minimum, educate them about the hand washing, mask wearing, and things of that sort.
And I agree with Sue. A lot of education has taken place here as well, in different languages. Pennsylvania translates documents in at least 13 languages because of all that, because it's easy to blame recruiter, and sorry, not recruiter, of migrant family, for something that goes wrong. And we saw that in Pennsylvania, where our chicken plant, not too far from my house, there was a big outbreak of COVID, and the plant manager gets on TV and is blaming the migrant workers, saying everybody comes in one van. So if one person shows up, has the COVID, everybody has it. It's their fault for coming in one van. But we know that they come in one van because they don't have transportation, but educating them of looking for the symptoms as well as wearing the mask and washing their hands and so forth has been crucial.
I think you guys touched on some really important issues with our families. A lot of them were in a catch-22 situation in that they were deemed essential workers, yet they had to choose versus going to work or getting sick and then bringing it back to their families, and that was really hard for them. We do have a couple codes. We have about 15 more minutes, but we do have a couple questions. This is from Masiniath. She wanted to know, Carmen, are you able to share your ID&R plan? Is that possible?
Yes. Yes, we will share. We will work with Jose and to get that. We have the guidebook under the pandemic, and we have an ID&R plan. Another thing that we had for services, we asked to each region to create a plan to how they're going to provide services and all the measures that they were going to take, and they had to submit it to our office for approval. So, but I'll work with Jose to get that. Do you want our regular ID&R plan or the guidebook that we created for COVID?
I think the guidebook, Jose was able to already put the guidebook on in the chat box, but is there a link on your guys' website, Pennsylvania's website for migrant education that has the ID&R plan on it?
I'll work with Jose on that. Yeah.
Okay. And then the other question was, how are the migrant workers in your state responding to the vaccine? Are they willing or reluctant to get vaccinated?
I would say in Pennsylvania, we have a mix. Some of them might be religious beliefs. Others are, and the main ones, they're reluctant. It's not that they are reluctant because they don't believe in the vaccine. It's because they don't want to lose work. A lot of them, the vaccine has been out for, I believe, close to 2 months now. And it's so much information out there about, especially when you get the second dosage, you have all the side effects. So a lot of them are afraid of, if I get it, I'm not going to be able to go to work the next day, and that can cost me my job. So it's a mix where we are respecting their beliefs. And the instructions to the field is educate, but we cannot mandate or force them because we have to respect their beliefs of the why they don't want to get it. But a lot of them, what they are saying is basically, I don't want to lose work. I don't want to lose work. With the first vaccine, they could lose work to go and get it. And the second dose, they could lose work the day that they get it and the day after because of the side effects.
Sue, in your state?
I don't have enough information to really know beyond what Carmen has already mentioned. The same with population, or I even think of my own family. Some are advocates for it, and others are like, absolutely not. But I don't have a good sense in regards to the migrant workers and which way they are. Good question. Good thing for me to follow up on.
Maria Mendoza also said, what things are you doing in your state to positively promote the vaccine within the migrant workers? And I think some of you, both of you kind of said it's been a challenge.
Yes.
Mhm.
And it's
Yeah.
just educate, because they might not want it because of their own religious belief, and we have to respect that. And others could be because they listen to everything else and they focus on the negative. But we have to respect them as human beings. And the only thing we can do is share the information and educate them. But they'll, at the end of the day, they'll have to take their own, make their own decision.
Mhm. Agree.
Mhm. Okay, we're coming down to the end, but we'd like to ask you guys, one of the challenges that COVID had was it changed your allocation of funds and deliverable of services, because now some are inundated with more funds because schools were not open, they could not, or agencies could not use the monies. Talk a little bit about what's going on in your state as far as your challenges and resources, maybe donations from other resources to support the migrant families when you could not use your funds, or having to circumvent rules and regulations that in the past said, no, you cannot use the federal funds for that. Maybe go into it without being too much of the, not getting yourself into trouble, but kind of talk about how are you dealing with that, with the funding? And we'll start with Sue.
It's the funding piece is a concern, and I don't know, last week or 2 weeks ago, I had a meeting with all of the directors, coordinators of the migrant education program, and addressed that very thing because of COVID in this past year. Well, even the year prior, not being able to have on-site summer school, because the majority of our programs do have on-site summer school in significant numbers. So not being able to have summer school, but even through the year, it's decreased our on-site services. So I am concerned about how and knowing that there was money left over from prior COVID, and eventually that has increased this year. So the other part is other programs, or even through the ESSER funds. So there's more funds coming through ESSER, and more funds focused in the 21st century program, the homeless program. So they'll be increasing their summer activities. So often in the migrant program, we say migrant dollars are last spent. And so how will we do that? The last thing we want to do is return money. We want to make sure that we as a state are responsible and use those funds, because we know that our children and families have needs. But with the restrictions of COVID, it's certainly going to be more challenging. And I hope this big light bulb goes off and we can think of out of the box. And the other part of the funding too is I was in a conversation with some other federal program, Nebraska staff, and just concerned about what the teacher pool and para pool is going to look like this summer. Teachers are tired, paras are tired. It's been a hard year, and they have had to go above and beyond for a long period of time. So we are hearing whisperings that those that may have worked in our summer programs may not this year. They need the rest. And before, they might have just had, in past years through the district, had a June summer program, but not July. But now the districts may have June and July because of the extra funding that they have. So that's another challenge, is supplementing all those other programs, but they have so much funding as well. It's going to be a challenge.
Thank you.
One other thing one thing, and this will be my final, because I really want folks to know this, is that the world is good and there's many people that are very kind. And the state of Nebraska migrant program was truly blessed by an anonymous donor, and provided initially millions of dollars for struggling families. Our migrant families were included in that, And there was a process, or they had to complete an application to see if they were eligible. And it was funds for needy families that did not receive a stimulus check. So if they did not receive if they did not receive that and met the other basic requirements for these funds, they received $1,000. So two of our migrant staff, Veronica and Ita, they were very involved in this project with the anonymous donor and other agencies. But on another go around of funds, it was specifically for our migrant families because they organized their involvement so well that the donor recognized that and provided additional funds for our migrant families. So I think that go around has just a little under $500,000. I think it's around 400,000 that went to our migrant families this year. I think Veronica and Ita, they have almost a quilt of thank you notes to them that they truly were angels. It's called the Angel Fund. But and that go around, it was well, I don't want to misspeak, but I think it was for each individual, maybe in the home. So, but over age 18, I should say, and did not receive a stimulus check. So, Veronica and Ita, I hope I got that right. So, a true blessing for those things that the migrant program could not provide those families, or to meet maybe a need that otherwise wouldn't have been met. So that's going to be my closing, because it truly has been a wonderful benefit for our program. And it also, so once families heard about this, they start calling Ita and Veronica, so it became a good way to screen for eligibility for the program as well. I want to thank everybody that came to the session today. It's been great working with you, and enjoy the day.
Thank you, Sue. Carmen, any thing to add? We have only a couple more minutes left.
We also had anonymous funders that gave us money, and we had around $50,000 for our families. Also, they were giving priority to those families that did not qualify for the stimulus check. And also they gave us over $5,000 to purchase PPEs exclusively for our families, for the workers. And we were able to purchase those and deliver to that. So tagging along with what Sue said, yes, there are positives to the pandemic. There are a lot of great people out there. And in the same way that we need to make contacts, we need to find families, there are a lot of agencies that also need families for them to meet the requirements of the services. And in Pennsylvania, one of the top Central Pennsylvania child care centers that's recognized by our Department of Education, they receive a lot of government money to provide child care services from 6 months old to kindergarten. And they bought iPads, they loaded with lessons in different ages. They had the teachers, but they didn't have the kids. So, and everything was being done virtual. So they reached out to us and they said, we can get your kids for free. We will deliver the iPads. For their older kids, there was gonna be laptops and with all the accessories, and they were gonna have also laptops for the mom, for the parents too, so they could also participate. And we were gonna deliver lessons. And we will get online X amount of hours, X amount of days, and work with the kids. And we were able to refer several families between 6 months old all the way to kindergarten level to them and to take advantage of these educational services. And because it was virtual, it was statewide. So we have families all the way from the northwest part of the state that it's actually 5 hours from where the agency has the headquarters to to close by receiving now these services, and they are for free. So always check the same way that we need, there is a need out there to be met, and our families can receive those services and take advantage of that. Also, thank you everybody for listening to us. There is a lot more that we could talk, a lot to share, but communicate with each other, partner with each other, partner with others, and we're all gonna get out of all this hopefully sometime soon. Thank you.
Yes, I really want to thank
Yeah.
our two panelists, Sue and Carmen, for their expertise, their wealth of knowledge, for what they shared. Many people in the chat box have said thank you, and they appreciate what you guys have shared with them. Great ideas, and they wish everybody all the best. Again, for Carmen, who's the State Director of Pennsylvania, her email address, in case you weren't able to get it on the chat box, is cmedina, MEDINA, @pa.gov. And for Sue, who's the Migrant Director in the state of Nebraska, her email address is sue.henry, HENRY, @nebraska.gov. So again, I want to thank everybody for your participation in this meeting, to Sue and Carmen and Alex for manning the boards for us. Again, we appreciate all of what you guys have done, and we're looking forward to everything that is forward, just one day at a time, gang, and we'll get through this, as everybody has said. Again, my name is Kaulukukui, and I was happy to be a part of this, and thank you to the ID&R consortium, IDRC consortium, for allowing us to participate in this conference. So everybody have a great day, and we're signing off.
So thank you.
Thank you. Thank you, everybody.
Good to work with you, Carmen.
Thanks.
Yes, thanks. Thanks to
I'll
both
be
of you.
calling you soon.